Heart murmurs can be mysterious sounds that your heart makes during its normal beating cycle. Often, these murmurs are innocent, meaning they are not a threat to your health and do not require treatment. However, understanding when a heart murmur may indicate something more serious is crucial for maintaining cardiac health. Murmurs occur due to turbulent blood flow through the heart's valves and chambers. Causes can range from congenital heart defects, such as a hole in the heart, to acquired conditions like valve calcification or rheumatic fever. Key symptoms to watch for include shortness of breath, chest pain, or swelling in the legs, which may suggest an underlying heart condition. Diagnosing a heart murmur typically involves a stethoscope examination by a healthcare professional, followed by further testing like an echocardiogram if necessary. Treatment depends on the underlying cause. Innocent murmurs require no intervention, while others may need medication or surgery to correct valve issues. Regular checkups and attention to heart health are essential. By understanding heart murmurs, we can make informed choices about our health and when to seek medical advice. Share this post to educate others and spread awareness.